Okay, we don't have a lot of questions, so I need to introduce Mrs. Ramlawy. Nice to see you today with us. Mrs. Ramlawy is very brave to present to us actually her vision. She is already a psoriatic arthritis patient, treated almost now for almost 1 year, and she got some troubles to diagnose her case, and actually it is good to see from the other side what's our patient feeling and what's our needs and how we can help our patients more through her experience. So Mrs. Ramlawy, the floor is yours.
Thank you, Dr. Ahmed. Actually, I just want to say thank you for inviting me to this webinar, and it's an honor to be presenting to everyone here. I'm just going to be sharing my screen because I've prepared some slides to share with you my journey. So my journey actually started in November 2018 when I had physical signs of things on my skin which I didn't understand what it was. And so I went to a dermatologist in December 2018 when I was diagnosed with eczema, and she prescribed to me some topical ointments and creams. And by January, I didn't have any improvements. So I went to another dermatologist who also told me this is eczema, and she gave me other topical ointments and creams. And at that point, the visible signs I had were roughness in the skin and the visible signs in my scalp, on my scalp. So, and I thought this was dandruff at the beginning. So okay, this is eczema, and I kept putting the ointments and the creams, but there was no improvement. So in March, actually, in March, so yeah, the medications I used were topical ointments and creams, and drops for my scalp, and actually grandmother's remedies, as we call it. So I used olive oil and natural mixes that people were just telling me to use. So in March 2019, I was in a visit to Cairo, and I went to a dermatologist, and this was the first time I got diagnosed with psoriasis. She told me this is psoriasis, and there's no doubt about it. And so I went to another doctor to get another opinion, and she also confirmed psoriasis, and she referred me to a dermatologist in Dubai because this is where I live, and I need someone to follow up my case. So when I came to meet the dermatologist in Dubai, he told me that yes, confirmed psoriasis, and he prescribed oral tablets. So this was the first time I started oral tablets, and he told me to continue on the topical ointment. Now my struggles here were that until March 2019, I was being treated as this is a skin disease. Okay, what I later knew that psoriasis is not a skin disease. It's actually like it's psoriasis disease. It affects different parts of the body, and it's not skin disease. So this I never knew. And so later on, yeah, so let me tell you about my struggles here. So there was no reference from the dermatologist to check my joints. Okay? The only thing they said is they asked me if I have any pains in my joints, and two of them actually asked me, and I told them that I had some pain, but it didn't last for more than like 24 hours in my ankle, and that is it. And honestly, it didn't cross my mind to ask them why they're asking about my joints, and they didn't tell me anything, okay? So I was not informed of any possible development or that psoriasis is a disease and not a skin disease. So after taking the 10 days of oral tablets of when the dermatologist prescribed, I had body aches, and he advised me to discontinue the medication I was on for 3 days and then resume again. And at that point, honestly, I was a little bit mixed up about, okay, so if this medicine is causing me some body aches, why should I resume it, or why should I take it again? So here I started my, this is how it looked in April 2019 on my skin and on my feet. So at that point, there was nothing on my nails yet. But I felt that there was something missing, and I started doing my own research and reading about it. And then I just had a little bit of visible signs on my nails, okay? Not the development, but the beginning. There were very little signs and little pitting in my nails. So I started researching about this. And this is where I found that there is a link between nails and psoriatic arthritis. At that point, I did not understand what psoriatic arthritis is. I had no idea. It was the first time I hear about it. But I found a lot of articles talking about this link between nails and psoriatic arthritis. So, and the visible signs, of course, were getting worse. And I started then looking for a rheumatologist because this is what the articles told me to do, that if you have psoriatic arthritis or if you have signs on your nails, you should go to a rheumatologist to check. Okay.
Please, Mr. I need to interrupt you a little. So
yeah, sure.
You are starting to suffer almost for 1 year for a disease was not diagnosed initially until you get diagnosed, and you're not advised at all to visit rheumatologist.
No, not at all.
Okay, so I think the objective of Miral talking is not about promotion of specialty or something, or even medication or treatment protocol. We are looking for the gaps between us and our patients. So we need to work more, I think, for to catch our patients with joint disease and something like psoriatic arthritis to more. What do you think about how we can work on this, Miral, in your?
So I think a lot of awareness is needed. A lot of collaboration between dermatologists and rheumatologists. So later on, I met 2 other patients with psoriatic arthritis, and they only knew that they had this when they woke up one day. One of them had swollen joints, and one of them couldn't even actually stand up and walk. Because when I started sharing my story, I met other patients who had the same issue, but they discovered it later on.
Okay, continue.
Yeah. One more thing, there was an event held here in Dubai, and it was about psoriatic arthritis. And I actually, when I went, it was more about dermatologists speaking about it. Okay, so I feel that rheumatologists need to be in such events and doing more awareness about it. Yeah.
Great.
So when I found out that I need to see a rheumatologist, out of the articles that I found, I just went onto the Saudi German hospital website, because this is the hospital I usually use for me or my kids. And this is when I found Dr. Ahmad's name, and I just booked an appointment and I went to him. Okay. And his first question was, who referred you to me? And I told him, no one referred me to you. I was searching for what's happening with my nails. And this is when I got to know that there's a link, like a possible link. So when someone tells me I have psoriasis, and I tell them, okay, do you need a rheumatologist? Yes, please go to a rheumatologist. Because if I hadn't gone, I wouldn't have known that I have psoriatic arthritis. I would have been getting treated as if this is a skin disease, where this is not my case. So, so a lot of people think that psoriasis is a skin disease, not a disease that involves other parts of the body, as I shared. And I met 2 other patients who discovered it when they actually had a big problem, and then they had to get treated. So how your rheumatologist can help, and I'm sharing here my own story, educating about the disease and the considerations and treatments. So Dr. Ahmad took me through the disease, and he explained it to me in very simple words. He told me what I need to consider in my lifestyle, that I need to get away from stress, what the treatment means to me, that we might be trying different kinds of treatment, which actually did happen. And by monitoring my case, we changed the treatment after a while. Supporting with information and success stories, this gives a lot of hope. And I think patient panic comes from not being informed. Yes. So if I'm informed and I have information, then I know what to expect.
Okay, so I'm saying that if the patient informed that there is already a chance of failure of medication, and we have also, but we have other options.
Exactly.
What starts as a good for you to not be depressed from just failure of one medication.
Yes, and actually depression and emotional turbulence is a very big part of it, because when my nails started to crumble, this was like the toughest time for me. So also the dermatologist answers inquiries and worries. So for example, one day I woke up with a red eye, and I sent a picture to Dr. Ahmed, and he actually told me to come to the hospital and book an appointment with an eye doctor to check it. But then it didn't end up to be linked to the psoriasis. It was just a dry eye. But normally I wouldn't have done that. But because he told me, if anything happens, if you find anything unusual about you, you have to tell me. If he hadn't told me that, maybe I wouldn't have also checked with him. So if the patient knows that they can actually get their inquiries answered, it's a very important thing.
So a patient should know about the spectrum of the disease, that there is some domains that could be affected, which is not related to joints or skin even.
Yeah, and honestly, when I woke up that morning with the red eye, it didn't cross my mind that it might be linked. And I was like hesitant, should I send him or not? And then I remembered, no, he told me I have to send him everything. So I did. So I would never know everything linked to the disease. So also the dermatologist, like for me, it enabled me to see the disease holistically. So it wasn't only the external signs, but also what's happening inside me with my joints. Regular monitoring, of course, through blood analysis and ultrasounds and physical investigation is really important. I feel like someone is really following up on the developments and like knowing where I am in my journey. Ensuring you have access to your medication, like a patient, like Dr. Ahmed, he always followed up. Did you get your medication? Did the medical insurance reply back to you? So making sure that you have your medication, and if something is not available, then there are other alternatives. And most importantly, like a partner on your journey, because this is really important psychologically and medically as well. So as I told you, we changed the medication. I first started with the methotrexate in April 2009. It really didn't work well for me. So later on, in June 2019, Dr. Ahmed prescribed the Taltz for me. Unfortunately, I was traveling during July and August, so I didn't have access to the injections. So of course, the development kept going. So as you can see, in August 8, 2019, my nails had really developed. This was September 2019. This is when I returned back to Dubai and I started the Taltz. So I'm now going to show you the development that happened to my nails and my skin. So the right picture is, of course, before, and then the left is after. And again here. And then this is after 4 months. This is how my nails looked after 4 months, and also my skin. So here you can see the development. And here again. And then these two photos were actually taken yesterday. So this is 10 months after Taltz. This is how my skin looks and my nails. Almost like, yeah, back to normal. I don't have a problem with it anymore. And this is how my skin was in April 2019. And this is later on. And then this is yesterday. So, this is actually the ultrasound showing the blood flow around my nails and my joints. The top image is, of course, how it started, and then how it developed later on. And I want to just maybe finish off with, Dr. Ahmed, do you want to say anything about these images?
No, actually, I like your way of presenting your case. You are very brave.
Okay, thank you.
If you'd like to advise us with any insights, something you need to advise for other patients to help, or other, we have over 300 attendees from all over the world, rheumatologists. So if you can give us more advice.
Actually, yeah. I wanted to, actually, this is my last slide, and then I will just wrap up. I'm very privileged to be in the UAE, honestly, for the healthcare services that are already offered to its citizens and its residents. I consider this a privilege. However, some treatments are still very, very high cost for patients to afford. And for example, for me, the Taltz, it costs, one injection costs 7,430 dirhams. I take one every month now. So it's a lot of money for me. And even with the co-payment, I pay 1,480 dirhams per injection. And besides all the other expenses that I have, it's a lot of money. So the discovery that a patient can have an assistance when it comes to the financial cost of the treatment is actually available, and it has three pillars. It's of course the manufacturer of the Taltz or of the medication that they're taking, the pharmaceutical company that makes this co-payment or shared payment with the patient, and of course the medical doctor. So I think this is one of the biggest roles of the medical doctor, is to let the patient know that there are support and assistance programs that can help them financially to get access to the medication that they need. The psychological support is really, really important. Because I'm a coach, so I had the ability to work on myself a little bit when it came to times that were very difficult emotionally. So the support the patient gets psychologically is really, really important. Keeping the patient informed, and the collaboration between dermatologists and the rheumatologists, I think this is the highest importance, because I've met dermatologists, honestly, that were actually upset that I am being followed up by a rheumatologist, not a dermatologist. So because once I went with my son to a dermatologist because he had an issue, and we were talking about psoriasis, and there was clear, I think he was really upset that I go to a rheumatologist. So I think this is really, really important. And people getting treated as a skin disease, knowing after years that there's something wrong with their joints, a lot of patients can be saved all this pain.
You know that I believe that the outcome of all our work is patient care. If you get a good patient care, all of us will succeed. That's why you are here with us, to give us what's happening and what you are seeing, your case to be treated, and how we can work to improve our patient care towards you and toward all patients with psoriasis and psoriatic arthritis. So I hope your comments to be considered all over the world to improve the patient journey in different parts, and also for us to improve our cooperations and the collaboration with other specialties.
Thank you so much, Tata.
Okay, thank you, Mral, for being with us.
Thank you for inviting me.
Thank you. Can you stop sharing, please?